Osteosarcoma is a highly malignant disease of children and adolescents. Currently, there are very few prognostic markers to tell us how a child or an adolescent is going to do long-term after treatment. And treatment consists of chemotherapy and surgery. The gold standard for predicting how well a patient will do with this disease is looking at the tumor after chemotherapy and after surgical resection to determine how necrotic the tumor is. What we don't have is a way to predict response to chemotherapy or risk of metastatic disease and or death prior to the initiation of chemotherapy or surgery. Our study looked at two cell cycle checkpoint regulators, P21 and P16, that had shown promise for indicating biologic aggressiveness in our cell culture studies previously. When we looked at these two biologic markers in over 100 osteosarcomas, we found a strong correlation between their expression and metastatic disease and overall survival in children and young adults with osteosarcoma. We believe this is a major advance because it gives us the opportunity to perhaps stratify patients going forward prior to therapy as opposed to submitting them to terribly toxic chemotherapy up front with no real indication of whether it may or may not help them.